Hello and welcome to Patient Better. In this video, we are going to discuss what kind of education Patient Better teaches, and we will share how our approach to proficiency in healthcare works. First, I wanted to touch on something that clinicians understand whereas patients struggle to discern. Studies indicate that when the electronic health record was implemented, it divided patient education into two. The first part is condition management education, which is reimbursable, allows providers and patients to focus on diagnosis management, and is taught individually. The second form of education is standard and was not recognized as reimbursable according to payer standards and has been omitted from electronic point-of-care services. In the last 2 decades, the healthcare industry has embraced technology while statistics prove that only 50% of health consumers have reliable access to the internet. Our program's curriculum consists of 24 healthcare management micro-lessons. We use real-world examples cognizant of our current clinician-consumer technology disparities in our instructions so that patients will learn the essential training of appointment preparation, treatment participation, and record governance to succeed in today's medical landscape. After consumers graduate from our program, they will be offered to take learning to the next level and transition their paper records into digital form. It was our objective to supply a service to clinicians that would teach consumers about healthcare management that would not entail additional administrative responsibilities and provide a more information-driven appointment. To learn more about how we can help your patients and caregivers become proficient in healthcare management or acquire your own location, visit us anytime. Thanks for watching.